Hi, and thank you for joining us for Enloe Medical Center's Healthier You Facebook Live series. Heart disease is the leading cause of death among men and women, according to the Center for Disease Control and Prevention. In fact, every year more than 600,000 people die from this condition and more than 700,000 people suffer from heart attacks. Luckily, there are steps you and I can take to help improve our heart health. Hi everyone, my name is Susie Lowry Hall and I'm Enloe's Community Outreach Coordinator. I am joined today with Dr. Joanne Alonzo, who's a cardiovascular disease specialist with Enloe's Cardiology Services. Today she'll be sharing with us on how to improve our heart health in honor of American Heart Month. But before we get started, please remember that the information that we're about to share is not intended to be medical advice. If you have questions about your heart health and the health of a loved one, please make sure you speak with your provider. But as always, feel free to post comments and questions in the comments field, and we'll do our best to answer them throughout the broadcast. And with that, we'll get started. So thanks again for being here.
Thank you for having me.
So we'll start with, what is heart disease and why is it the leading cause of death among men and women?
So heart disease really is an all-encompassing term. It includes coronary heart disease, heart failure, arrhythmias, valvular heart disease. I mean, you name it, there's a lot of components to it, even outside of the heart, including aortic disease. It's the number one leading cause of death because about 47% of people in America have at least one of the three main risk factors: high cholesterol, high blood pressure, and smoking. And so if you think about it, 47% of people in America have one of those. They're going to be at risk for heart disease in general.
Wow, that's significant. That's a lot of people. So what puts people at risk of heart disease?
So just as I mentioned, those three are the main things: high blood pressure, high cholesterol, and smoking. And those are all lifestyle changes that you can make to improve those. Other things include obesity, diabetes, and just an inactive lifestyle. So if you are not physically fit and you're sitting around spending your days really just kind of going to and from work and not really getting out there and doing something, that's a big contributor to it. The next one is diet. You know, a lot of people go out to eat. Granted, there's a lot of great restaurants here, but, you know, just eating at home, making your own foods, eating foods that are not processed can reduce your risk as well.
So that's really helpful to know. So what are the symptoms of heart disease?
So a lot of heart disease is oftentimes asymptomatic because if you think about the three things I mentioned, high cholesterol, high blood pressure, and smoking, you know, that's sort of just in your standard lifestyle, you don't feel any of that. But if you are in danger of having a heart attack, which is what we think about, the main thing we think about is chest pain, which is why chest pain is a big deal when you go to the ER. If you complain about chest discomfort, you're going to get the full workup. And so chest pain is one of them, and it can be crushing, it can be dull, it can be achy. It can just feel like pins and needles. Oftentimes it can radiate to your arm, sometimes into your jaw, and into your ears. Some women are not as typical. They'll have abdominal pain. Sometimes they're just diaphoretic or sweating, nauseous and vomiting.
Oh my God. Well, that's really good to know. So it's nice to know that both men and women have different symptoms that we should look out for. That's helpful. So what should someone do if they are experiencing those symptoms? What would be the best course of action?
The best course of action is try to get somebody around you to pay attention to you. And they can either call 911 or if you can call 911 and get yourself to the hospital quick. The last thing you want to do is drive yourself there because if something were to happen, you want to be around somebody that can sort of take immediate action and either take you there or perform CPR, God forbid, that was needed.
That's really good information. I think that's really helpful. I've noted for sure. So what are some things that people can do to improve and reduce their risks of heart disease? What can we do?
Number one, get out there and move. 30 minutes every day, whether it's walking, jogging, you know, something that is getting your heart rate up and moving for continuous 30 minutes. That's the best thing that you can do for yourself. The second thing is diet, like we talked about. Really, you know, a lot of the fad diets we try to stay away from. You want to try to really change your lifestyle more than anything. So cutting out anything processed, trying to stay away from trans fats and saturated fats. Red meat has often been a big topic of controversy. Do we eat red meat? Do we not? But the less red meat that you have in a week, most people limit it to 2, or you should limit it to 2 times a week. And then eating fresh vegetables, legumes, fish, poultry, things like that.
Great.
Other things you can do is go to your doctor. I mean, just go get the regular checkup, because oftentimes a lot of this stuff is asymptomatic. So they will check your vitals, they will check your labs, and they will ask you the questions that need to be asked. Do you have a family history? What are your other risk factors, including what's your lifestyle? You know, if you've ever had any issues in the past, health issues in the past, such as diabetes or high blood sugar, they can monitor for things like that.
How often would you recommend that people go and get checked with their doctors?
At the bare minimum, your annual exam.
Okay.
Yes, I do think that the annual exam tells us a lot. And a lot of people kind of, say, well, I went last year and I did okay. The best thing you could do for yourself is to go back and just have a conversation. And the worst thing they can tell you is, we gotta, you can go home and we'll see you next year.
Yeah, right. You're still doing okay.
Right.
Yeah, I like
Yeah.
that. Okay, good.
Yeah.
Thank you for that. Enloe is improving the healthcare and the heart care of the North State by opening up the new Alice Starmer Cardiovascular Center. Would you please share a little bit about that with us and what we can
Sure.
expect?
Yeah, it's a very exciting new thing for the cardiovascular department. It is a new space for health and healing that doubles our capacity for treating our patients, as well as providing new equipment, a very up-to-date equipment, and a new area for diagnostic testing, which is also very important for cardiovascular care. We have so many more new cardiologists here in town, and we're starting to develop a new valvular heart program and hopefully a heart failure program. So in addition to the things that I talked about earlier with heart disease, it really encompasses a huge spectrum of heart problems. And so right now, the cardiac cath lab is really made just for coronary disease, and now we're opening it up to allow us to treat some of the other more advanced diseases now that our coronary patients are living longer.
That is amazing.
Yeah.
That's very cool. Okay, good.
Yeah.
So, Enloe was also recognized by the U.S. News and World Report as top performer in abdominal aortic aneurysm repair and heart failure. Can you share more about that and what that means for the hospital?
Sure. That's a great recognition for our hospital, especially with the size of our hospital and our population. The abdominal aortic aneurysm, as I mentioned, heart disease doesn't only encompass the heart itself, but the aorta. And so that is one of the
That is one of the recognitions, yeah.
Right, that's one of the recognitions. That's more vascular care, but that's great because cardiologists help to diagnose those programs or those problems too.
Mm-hmm.
Heart failure is not brand new, but a big thing in cardiovascular disease, because a lot of our coronary patients are living longer. As a consequence of people living longer, people are then putting themselves at risk for heart failure. Heart failure is a very complex disease, and oftentimes it's diagnosed when you're in the hospital with symptoms of shortness of breath, swelling, weight gain, sometimes chest discomfort. And so a lot of people don't know that they have this until they're hospitalized. And so the U.S. News sort of looked at all of these things that we do in the hospital, including nursing care, survival, patient safety, and a lot more metrics that they use to measure how well these patients do in the hospital and outside the hospital.
Mm-hmm.
The most important thing is trying to prevent readmissions with these patients, and our hospital was recognized for that.
That's amazing. Well, congratulations. It's
Thank
very
you.
exciting.
Yes.
So this has all been really great. Thank you so much for joining us today.
Sure.
Before we wrap up, is there anything else you'd like to share with us before we end today?
I would like to mention that you are wearing red, and this month is Go Red for Women, as well as American Heart Month. And as this month comes to a close, I really hope that you guys will take some of this information and go to your doctor, be more proactive, get out there, walk, run, jog, whatever you feel comfortable doing. make changes in your health, make changes in your diet, and make sure you're just screening, your risk factors, and make sure you quit smoking. Check your blood pressure, check your blood sugar, check your cholesterol. And if you can get all those kind of in line, then you'll really reduce your risk of becoming one of my patients. And I think I just wanted to mention that, we're doing so much for the community, and I really like to encourage my patients to really know their health and really know why it is that they go to the doctor, why you're taking medications. And it's good to always ask questions. And so I just want to encourage all of you guys to ask questions here to your provider. If you need to, come see me and I will answer them as best as I can. So get out there, walk, and hopefully we'll see you around the neighborhood.
I like it. That's good. Yes. So while you're out on that walk, make sure you say hi to Dr. Alonzo. But until then, we look forward to seeing you at our next Facebook Live discussion in March. Take care.